Hi, class. My name is Anna Matthews. I am presenting the role of emotional intelligence in nursing leadership. I have enjoyed this topic and have deep dived on it. Um, I'm on my agenda for today is introduction, explaining what emotional intelligence is, what is emotional intelligence, why intelligence matters in nursing leadership, impact of emotional intelligence in nursing, developing emotional intelligence, benefits of emotional intelligence in nursing leadership, and addressing nursing shortages. And then we'll conclude. The role of the emotional intelligence in nursing leadership. So, today we're going to explain the critical role of emotional intelligence in nursing leadership and its profound impact on patient care and team dynamics. It's emotional intelligence affects the whole gamut, not just the nursing side of it, but it also affects patient outcomes. It affects team morale. It affects um, patient safety. So it's essential, like as we're heading to a new direction where we're more independent, yet we're dealing with huge nursing crisis where we don't have enough support staff. I think what we're going to have to do is move more towards that emotional intelligence leadership. Okay, so by definition, emotional intelligence refers to the ability to recognize, understand, and manage our own emotions and others. So when we are in a crisis mode, which in nursing, it's constant, we have to take a step back and actually take some reflection. Being reactive causes huge explosions in units, huge explosions in team dynamics, huge explosions within patient care and families and staff. So it's essential as a leader to create that buffer. And sometimes, as the leader, having that awareness of who on your team is able to manage high conflict, or if they are not able to offer that resource that as a nursing leader, you can step in and have their back and de escalate the situation. A lot of times, we also have, as a nursing leader, we have to be aware, like constantly be assessing our own nursing staff to make sure that they're okay. I view them as taking care of nursing our nurses, taking care of our nurses, making sure that they're in a good place to be dealing with high conflict situations. We don't want to put a nurse who's going through something in her personal life in a very high conflict situation, because that is just a beautiful recipe for disaster and burnout. You don't want to put a new grad or unseasoned nurse who doesn't know very well her footing and how to de-escalate situations. Like, she would have to shadow those situations a few times before she's able to manage it on her own. Components of emotional intelligence require self-awareness, recognizing and understanding our own emotions, self-regulations, that's taking that breath and learning how to calm that down, social awareness, being aware of everybody around your surrounding, and relationship management, building and maintaining healthy relationships. So, emotional intelligence is crucial in order to create these team dynamics to be successful. If our leader does not have that, it will burn out our staff and it will burn our nurses out and aides and everybody who is working as a team. So it starts with the head and it's going to require that emotional intelligence. Why does it matter? So the studies have shown that it increases patient care. It enhances communication with patients and family. You can prove it, if we care for our nurses are able to care for our patients effectively. So if we give them that empathy forward, they'll be able to pass it forward. Team collaboration, if we create that dynamic of we are all here for each other, we are here, let's check in with each other, let's make sure that they're not hurting or they're struggling, it will help reduce that anxiety and that stressfulness can't completely get rid of all the stress, but it can be manageable. And obviously, the staff morale reduces burnout and turnover rates and boosts job satisfaction. I had a beautiful leader in hospice. Um, her name is Sue. Um, she had this emotional intelligence down to pack. She knew who, she was constantly checking in with everybody. She knew who was struggling at home, who had what needs as a staff member they needed, who needed to have the easy case today because they're operating at a 30% today versus my other nurse who's operating at 100%. And giving them the easy cases or um, giving them different cases. Like we knew, we were fully aware that we had some nurses who had traumatic backgrounds with alcohol, and we always steered her to a different direction, not let her deal with any cases that had directly deal with alcohol. Or I had other nurses who um, were not great at de-escalated situations. So we always steered her more, assigned her more of the caseload where it wasn't high conflict. So we were trying to do what's best for the team, what's best for the unit, for the families. And at the end, what was beautiful, what we saw like out of her leadership, but she was always recognized for that, was that she was never understaffed. She was never short-staffed. And she was constantly receiving awards for the leadership in the house, for how much the team in the house in that inpatient unit worked together. So within a short period time span of like 5 years or less, no, 3 years, I want to say, she received over 19 awards. So her gift was this emotional intelligence. So the impact of emotional intelligence, it's obvious that it's crucial for our leadership and it enhances it's crucial for our leaders. And what's really cool is if our leaders don't have that skill, there still can be learned. It's a learned skill. It's not just something that inherently you're born like with green eyes and then you cannot change it, but it's a skill that can be learned. Acquisition of emotional intelligence. It has to take through a lot of self-regulation, a lot of self-reflection, self-assessment. So my Sue and I always took debrief days. Um, we debriefed every day, and we would create a space for where she and I debriefed on what's going on with everybody and what's going on with her so she can take in, process, and then we can present ourselves the best we could at that time for our nursing staff, for our patients and the families. And it set us up for success. Um, and we constantly were assessing, we were constantly between her and I as saying, "Hey, give us, we're going to be truthful. Could we have done better here? How bad did we do here? Where could we improve?" We were always asking that questions. Where could we improve? Strategies for development. So it's essential that we're adding those reflective periods in your day. Like it doesn't have to be very long. For us, it was a 5 to 10 minutes huddle of where could we have improved yesterday and can we do it better today. And we always were trying to learn, seek more knowledge. We were always pushing to learn how to lead this team, a team of 33 nurses, which was amazing to do with her. Benefits of emotional intelligence. So obviously we reduce a lot of conflict. um, does not mean that we got rid of all the conflict. That's not the easy band-aid. But it was manageable and we were able to address issues and not leave it unspoken. We also did a lot of team building. We we enjoyed coming up with silly ideas too. brighten our nurses' day. We were always trying to um, create a funny contest or come up with a best quote to write on the board, or we created decorate like collaborate decorate the board for each holiday, or collaboratively decorate the Christmas tree. So we it was a pretty cool team. And we also increased the patient safety, retention. So we did retain a lot of nursing. So we effectively, while everybody was struggling with short staff, we were not. Everybody who were always asking for our nursing staff to come out to go fill in everybody else's places. But I nurses will work for a good boss. That's the end of it. And once you understand that, you will need to pivot and start learning this emotional intelligence. Um, Currently we are head on in the nursing crisis. So, in conclusion, emotional intelligence is vital for our leadership, and it's the most one of the most effective ways in our control to improve nursing retention. And I really appreciate you taking the time to see my video. Have a good day.